Right, hello everybody. Well, it's very bright up here, but hopefully I'll manage to cope. It's lovely to be here, and I've been chatting to a few of you, and I know that some of you are quite sceptical about this because you're not quite sure what to expect, but this is something I feel is very exciting. We've actually been planning these sort of events now for a long time. We feel as though, as a university, this is quite unique for us. We had 5,000 students that started this September, and this is the only university where every student will be involved in these interdisciplinary activities. You will learn a lot. Now, it's easy for me to stand here and say that, but I have heard from other students who've said exactly the same thing. I was at the Engineering Challenge on Friday, and it was their last day. And it was lovely because one of the things we were talking about was the new friends that they'd made. And I was able to look at some of the models and things that they'd made. Engineers, you can imagine, they have to make models of something, and they were making models. And they were fantastic. The thought that had gone into them was really good. So you will learn a lot, you will meet new friends, and I think that's so important. And I know, and this is why I'm so pleased to be here and to have been asked to launch the event, because this is my faculty. I know what your timetables are like, and I know they're pretty packed. So this is giving you time, and it's giving you some space, and it's giving you some time to observe and to look at the communities that you're going to be focusing on. I was listening to the radio this morning as I was driving into work, and there was an interview of a footballer who was retiring. And one of the things that he said, when he looked back, he could see what football had taught him. And he was saying that it had given him drive, it had given him focus, it had given him team working. It had given him confidence, and he was then able to trust himself and to trust others. Now, we're not expecting that this is we don't want you all to become footballers, heaven forbid, but we do, all those skills are all the sort of skills that we're trying to embed in your programmes over the next 12 weeks. Employers are telling us this is what they want. And we are very receptive to that because we know it's a very tough market out there, whatever you decide to do in the future. So, what are you going to do with your life? Now, this is just to prove that I am a nurse, but you can tell how long ago I was a nurse by the uniform. So, yes, 43 years ago, I became, in those days we were called staff nurses, so I became a staff nurse. Today I'm a Pro-Vice-Chancellor for Learning and Teaching. I had no idea that my journey would have taken me to this role now. So that's why what we're doing now is about preparing you for the future, whatever the future might be. Now, these are some of the jobs that didn't exist 10 years ago. So, an app developer? Would you ever have thought of becoming an app developer? Social media manager? Sustainability expert? Offshore wind farm engineer? Patient advocate? Big data analyst? Now, there are some there, I'm sure, that no one in this room would even dream of doing. But this is just to show you how times change. And, you know, even those of you in this room that think you know exactly the route that your career is going to take may have a little detour from time to time, may do something a little bit different. And I think, as a university, we have a moral obligation to prepare you for that. And that's what this is about. One of the things when you come to a Russell Group university, the expectation is that you're going to exit with a good degree. So anybody that goes to Russell Group University is going to exit with a good degree. We want to give you that edge over all of those people that are going to exit Russell Group Universities with good degrees. This is part of that process of giving you that extra little bit that's going to make the difference when it comes to you applying for those big jobs in the future. So which jobs are we doing that might not exist in 10 years' time? What are we preparing you for? We're preparing you to be fit for purpose, to be adaptable, to be able to use the skills that you're learning while you're doing this challenge. And there's a very good quote, and I use this a lot. It used to be in my old office. The secret of success in life is for man to be ready for his opportunity when it comes. And that was Disraeli that said that. And I really firmly believe that. And that's one reason why my career trajectory has been the way it has. Because I believe that I have been ready for those opportunities, and we want you to be ready for those opportunities, and we want to be able to prepare you to be ready. So we're living with change all the time. And what I want to do now is talk a little bit about some of those changes, but also what has helped me and what has influenced me. So I'm going to tell you a few little stories. I like telling stories, and I hope you're going to enjoy listening. So these are just a few experiences that have helped shape me and my life as I've been going through those 43 years. I was involved in what was called the CORAC project. It's a WHO project, and it was to reduce the maternal and the infant mortality in the former USSR republics. So we went to the different countries, a small team of us from this university and from the University of Bristol. We prepared workbooks on normal obstetric care. We had them translated into Russian. We had interpreters, and we held workshops to train the trainers. Now, in doing that, I went round a number of different hospitals. It was enlightening. The midwives who I saw were extremely committed to the work that they were doing. They didn't have journals, they didn't have books, they had limited exposure to the media. Television, really, because of the electricity as well, it wasn't there all of the time, and it wasn't up to date. So it was like, for me, going back 50 or 60 years. I witnessed instruments being boiled in a pan on a gas ring on the floor at the end of the corridor. They were desperate for equipment, so much so that they treated us like royalty because they thought we were there to give them some equipment. I witnessed some of the practices that they firmly believed was good practice. Just as an example, when the mother had had the baby, and after the placenta, the afterbirth had been delivered, they would put ice and weights onto the mother's abdomen. That was to reduce the bleeding. It's very important when you go to different countries that you try to understand why they've come to that decision. These were obstetric doctors that had made that decision. They gave the mothers red apples to try and increase their iron intake. We tried to understand why a red apple would improve their iron. They took a red apple off the fruit bowl and bit into it, and it went brown. So these were some of the things And we can laugh now about those sort of practices, but they firmly believed they were doing the right thing for their mothers. These were mothers who had to go into hospital for 4 weeks around the birth of their baby. They had to do that because there was no emergency services. They had to do that so they were more than likely going to be in hospital when they went into labour. I met displaced people, refugees, in long, very, very long queues to see the community doctor. I also went to Nigeria recently, and I was fortunate enough to go to one of the very poor hospitals, a community hospital, a rural hospital. And there I saw women with their young children, with their babies in some cases, sat on dirty mattresses with no sheets, no pillowcases. The children were malnourished. The fathers had brought them in to hospital and then left them because he couldn't afford to pay for the treatment. These mothers went home eventually with their babies once they'd been treated. They weren't long before they went back into hospital because the culture was that the man who went out to work should be the first one to eat at the table, to eat the food that the mother had cooked. I saw for myself how proud they were to show me an operating theatre. The operating theatre was full of equipment that no one knew how it worked. There were things like stirrups, one stirrup, the other one missing. But they were so proud that they had an operating theatre that eventually they would, they hoped, be able to use. These were really humbling experiences for me, and they helped shape me as an individual and had a huge impact on the way I saw things. I was a different person when I came back. So we have to live with change. We hear in the UK, change is constant. Part of this is about working as a team. We have to learn to work as a team. We have to learn to develop ourselves. We have to learn to be flexible. These skills that you're going to learn in this next 12 weeks is going to prepare you, I hope, for the future. So helping people to be healthy, this is what this is all about, but you need to understand, what do we mean by health? What do we need to live a healthy life? You're going to be exploring some of these things. You will be working in lots of different environments. In some cases, you'll be working with one patient at a time. In others, you'll be working with groups of people. In others, you'll be working with communities. And I do recognise that in this room, not everybody will go into a health care profession. Some of you may decide to do something different. That doesn't mean to say what you're going to learn over the next few weeks isn't going to be as important. So these are the things that you're going to get out of the health challenge. You're going to get the opportunity to learn about what makes people healthy, about how health is unequal, how it's unequally distributed in the world, and I've told you about some of those stories already. You will get a chance to learn about the teams, and what I would ask you to do is to reflect on your teams and how that works, how you work within that team. That's very important for you as an individual. It's important that you are aware of your own strengths and weaknesses, that you can help develop some of those weaknesses and they'll become strengths. But most important, and I think this is the key message for me, for you today, it's about enjoying this next 12 weeks. This is a time which is outside of what you would normally be studying. It's a time that's going to give you some freedom to think differently, to work with individuals from different disciplines, and to create something really good. It's also a chance to explore what kind of health professional you want to become, or what job you would like to go into. And I've just got, again, another quote for you, and this is, "Challenges are what make life interesting, and overcoming them is what makes life meaningful." I want to leave that quote with you. It was Joshua Marine who said that, and I want to leave that with you because I know, because I've also read some of the Twitters, I know the scepticism around, but I know we have all worked very hard to make this a huge success for you and to make it meaningful for you. And I want to just end by saying a big thank you for everybody who is in this room that's helped to bring all of you, over 450 people, together this afternoon to make this possible. And I look forward to being here in 12 weeks' time, just to hear some of the exciting things that you've been able to come up with. Because you will be going into communities, culturally diverse communities. You will be observing some of the things that are taking place in those communities. And you're going to be thinking, understanding some of those things much better, I hope, by the end of the 12 weeks than you do now. So thank you for listening, and please enjoy.
Okay. So, big question for you. Are you healthy? Yep. One person. Anyone else? How do you know? And this is a problem for us when we're trying to decide in the future whether we've done a good job of improving people's health. Is that measuring health isn't as straightforward as you'd think it would be, and how you define health is a tricky question. And I often use various different examples. You could look at some people like Stephen Hawking. Is he healthy? On one hand, you would want to say no. Here's a man with a pretty miserable, life-limiting condition, and yet he's overcome all the challenges that condition's presented him with and written a book none of us can understand that's probably going to change the course of human history. At some point, that man has managed to do enough with what he's got to be healthy, in my mind. So when we are teaching you guys to be professionals working in health and well-being settings, we're going to teach you a lot about what makes people sick. But in the next couple of weeks, we're going to have a bit more time to think about the things that make and keep people healthy and what's necessary to be healthy, because they're not always the same thing. I'm going to give you a couple of statistics here. So on average, if we looked at a child born today in Malawi, we'd expect them to live on average 47 years. And yet if we saw a child born in Japan today, we would expect them on average to live 83 years. If we went back to 1960, that same Malawian child would have only expected to live 37 years and the Japanese child only 68 years. Now the question there is, has something gone really right over the last 40 odd years, or has something gone really wrong? And I think you can view that both ways, can't you? I'm going to see if this works. We'll see if it... And I've been told I have to stay still. But I might break the rule. Sorry, Ash. What we've got here is a big graph. We've got down the bottom here the income of the countries. Okay, so this is a country's GDP. And then up the side there we've got how long you can expect to live. And we've gone back 200 years. So this is 1800, so beginning of 2 centuries ago. You can see all the countries in the world there are represented as little bubbles. The size of the bubble is the population of the country. What you can see there, we're looking at Malawi and Japan, and let's just see what happens to them over the next 200 years. Here we go, ticking along. To start with, we've got almost no statistics, so we don't see a lot of change. You can see some of the European bubbles there, those orange ones starting to take off and go somewhere. Japan's gone almost nowhere. Malawi, we've only got one measure. Here goes Japan, turn of the century. People seem to be getting richer. Oh, now people are getting steadily healthier in Japan. Oh, something happened there, didn't it? Okay, so engaging in a global war doesn't help your health. Okay, but something amazing's happened to Japan post-war, hasn't it? They've taken off both in terms of health quite very quickly and then in terms of wealth. And there's Malawi starting to move now. So we've gone from 30 to 40. And there's Malawi taking off again. So in 200 years, there's a bunch of things that have happened there. If we look at those two countries and just see the path that they've followed, they've gotten richer and healthier. And the same is true for Malawi. And if you look at where all the bubbles are now, and then go back to where they all were in 1800, everybody's gained, across the world, everybody's gained at least 20 years of life expectancy. So something quite amazing has happened over that time. What we're asking you guys to do as part of this challenge is to go out and see what you think has enabled people in the communities you're looking at to become healthier and what's keeping them healthy, and also to think about what's impacting on their health. When we go and look at Sheffield, we can see those same inequalities, that same gap that we see between Malawi and Japan in a smaller sense here. So this is a bus route of Sheffield. And if we follow the bus from the leafy green suburbs down in the southwest, by the time the bus is driven through to the middle of town, your average life expectancy is dropped by nearly 10 years. So you've got a 10-year gap. Now that doesn't happen to you just on the bus, don't worry. Something about the areas people are living in has made them more or less healthy over that time. And it becomes a chicken and the egg question. You know, does your health impact on where you live, and does where you live impact on your health? And they're both probably together. So what we want you guys to do is to go out and start thinking about what's impacting on health out there. I think that gap's not fair. Now these are my kids. This is them sat quite happily in a very nice cold part of the peaks, well rugged up. But their favourite saying at the moment, them being 3 and 5, is, "It's not fair. It's not fair, Daddy, I have to go to bed. It's not fair, I have to go for my bath now. It's not fair, I can't watch CBeebies all day." Okay. We're very good at recognising when stuff doesn't suit us, but we're not always that good at applying what's not fair to what's really not fair in the world. And I would argue that losing 10 years of your life by taking the bus to another part of town, or losing 30 years of your life by not being born in the right place, that's not fair. So why do we see these gaps? And I want you guys to think, what's going to be your role? Do you have to address that? Is it your problem? Okay, and I'm not suggesting that the answer will inevitably be yes. Okay, you'll have to decide that for yourselves, and you'll have to decide as you go through developing your careers what role you will take in addressing those gaps. One of the things that we're going to address as we go through this is knowing what a population needs to be healthy. And when we're going to talk about what you need to be healthy, the first question is how do we define a need? And it sounds like a daft question, but until you can actually say, what does somebody need and what can we give them, you can't actually make any kind of intervention or do anything to improve the health of a population. And this is a definition that has been used widely. It's not widely agreed. Not everybody agrees with this definition, but you're probably trying to find out why people do and don't agree with this. But you can define need as the ability to benefit from an intervention. Okay, now that's a tricky sort of a question, isn't it? If you wanted to go to your doctor because you've got a cold and you said, I want some antibiotics, and your doctor said, that's fine, and gave you some antibiotics, would you benefit from that intervention? And the answer is probably no, because the odds are your cold is caused by a virus, so your antibiotics wouldn't make any difference. So under this definition, you don't need antibiotics. Now that's quite different from what you might want, and it's often quite different from what we supply. So the next thing we're going to do is a bit of a game that allows you to kind of explore the difference between needs, demands or wants and what actually gets supplied in terms of health and healthcare. But hopefully you can think about it a bit more broadly, and we'll talk about a range of different things. So we're going to introduce this game. And on your tables you'll all have a massive chart printed out. You will see your big giant chart that looks a bit like this. And what you've got on that chart is 3 overlapping circles. It's a bit of a Venn diagram here. What I want you to do is to think really broadly with this. Think about things that impact on health and come up with things that fit each of those various sections. So, for example, you might be talking about something that's needed and supplied but nobody wants. At the other end of the scale, you might come up with something that's supplied but nobody needs, or something that's demanded but that we don't have. Try and fill in all those different sections and be creative. Like I say, I've run this game for a number of years now, and it's always interesting to hear what people come up with. I've heard Justin Bieber fit into the supplied but neither needed nor demanded box. So I won't go on with the various things that have filled that box because they probably the list would get me into trouble. I heard my best one ever the other day, but I can't reuse that one because it might affect somebody in the room. But have fun while you're doing this, but also think a little bit about it from a health and healthcare point of view. Okay, so we're going to give you a little bit of time to do this, and then we'll run on into the break after this. So have a go. With your facilitators, just have a chat and let's see what we can fill in those boxes. Thanks. Was that easy? The game, not the coffee. What sort of things, I guess, well, we can't really sort of take everybody as we go, but I mean, one of the things that we heard is that the health challenge has been supplied but neither needed nor demanded. So apologies for that. We set ourselves up for that one, didn't we? I think there's quite a lot of learning from that game, and the thing that always comes up when we do this is, well, where are we talking about? You know, are we talking about Sheffield? Because Sheffield is quite lucky. We've got clean water. We've got enough food, by and large, for everybody in the city. But there are other places in the world where that's not the case. And interestingly, when I do this game with international students, 10 years ago, if I did it with international students, they would always put roads as one of the things that were needed and demanded but never supplied. And UK students never thought about that. But obviously we've been spending less on our roads more recently. and the potholes in our roads are getting more and more noticeable, and people are starting to put roads on the map. The other thing I think is that a lot of those decisions are a bit subjective. You can see sometimes you'll write something down and somebody else in the group's thinking, oh, I'm not sure how to put that there. Okay? And we had a couple of discussions about things like, where do you put cosmetic surgery? And we had to split cosmetic surgery up to cosmetic surgery for somebody who's had some sort of disfiguring process versus cosmetic surgery for somebody who wants to look better to go out in the evenings. And it's hard to define the next part of the question, which is, if we said that need was the ability to benefit from an intervention, that benefit is tricky to define. Okay, so by and large, I guess what all of this is showing is that when we go out to populations and think about what they need for their health, it does become a bit subjective. You can't actually be rock solid about what people need. And so when we go out and we want to actually say, what are the health needs in a population or in a community, we've got three easy ways of doing it. Okay, we can count stuff. How many people are dying? What are they dying of? Have we got more of this? Okay, and then we get into comparing stuff. Have we got more of this than somebody else? Who are we going to compare ourselves with? What's a fair comparator? Okay, and you know, is it fair to compare Sheffield with Leeds? Is it fair to compare Sheffield with London? Is it fair to compare Sheffield with New York? There's all sorts of sort of questions you can ask yourself with all of those. And then the third way that you can go out and measure people's health needs is to go out and ask them, what do you need? And that's quite a revolutionary way. Interestingly, it was something that got developed overseas and came because people realised that when they went out and looked at health needs in developing countries, there wasn't any data. And often the information that people wanted wasn't collected in a reliable way. So they came up with this brilliant idea of actually going out and asking communities, what do you need to improve your health? And by and large, they got sensible answers. There's risks with all of these, and if you go out and ask people in Sheffield, what do you need for your health? I can pretty much guarantee you they'll all say, a new GP practice just down the road from my house. And you won't be able to supply that. So sometimes you've got to think about who you're asking and whether you can actually meet the demands that are going to come back. So for you and your group, your challenge is going to be to go out to an area of Sheffield, and you'll all be assigned a different area in your groups. That area is going to have different needs because different neighbourhoods in Sheffield need different stuff, partly because of who's living there, what they've got, and how old they are, where they are in life, what jobs they're doing. There's a whole range of different things that affect health needs. And your challenge, if you like, is to answer these three questions when you go out to your area. Think about what's affecting the health of people in this area. And that's the easy bit, probably. Then you need to come up with what should be done about it. And that's probably still relatively easy. And then the last question is going to be the tricky one. Why hasn't it been done yet? Okay, and you may or may not be able to answer that, but it's a very complex question. Why haven't we done the things that we think we should have done yet? And the easy cop-out answer is to say we haven't got enough money. But there'll be other reasons that you need to think through. In terms of your group and how you're going to answer those questions, you're going to have access to some data about your area, which your facilitators will give out and which is available on the website now if you want to go and have a look. And that's some statistical information. And statistics are fantastic, but they don't always give you the whole answer. So the other part of going and thinking about the health needs of an area is to actually go out there and visit the area, see what it looks like, see what housing's like, what transport's like, what things are affecting people's health. And that's a really broad question because as you'll learn through this process, there's a lot of things that impact on health and well-being. And then you're going to come back and at the end of this process, the expectation is that you're going to present what you found back to your peers. So you'll be split into smaller groups and you'll be presenting back to each other to say what you found in your area. And we haven't been at all prescriptive on what form your presentation can take, so you can come up with a bunch of PowerPoint slides, you can come up with some video, you can come up with whatever you can think of. I'm still waiting for a group to come up with interpretive dance. Hopefully that's going to happen. But that's the expectation, that you come up with something as a group. You're also going to be asked for yourselves to think about how you've worked as a team. And a lot of you will have done teamwork before, and you'll be looking at this challenge and saying, well, I've done teamwork, I've worked as part of a group at school, I've worked as part of a group in other courses, what's different about this? And the answer to that is that we've given you some resources on the website that you can have a look at that show how people think about how teams actually work and how individuals fit within teams. And it's a pretty important question, because you're going to be working in teams for the rest of your life, and thinking about exactly what makes a team go right and go wrong is going to be useful to you in the future, and be very useful to you whatever job market you end up in. And then finally, the expectation is that you're going to meet new people that you haven't met before, and you're going to have some fun. This shouldn't be the world's most demanding or time-intense piece of your education at this university. What this should be is a bit of fun and a chance to actually say some things and to think about yourself that you might not get a chance to at any other point in your course. You'll have a range of resources to help you along with this. So each group, you'll have met your facilitators by now, and your facilitators are there to get you talking, not to give you all the answers, but they should be able to point you in the right direction sometimes. Obviously what you do and how you take on this challenge is going to make a big difference to whether you have any fun. If you don't want to engage with it, you probably won't have much fun. If you actually get involved, you'll probably have more. You've all got your own website, and hopefully you'll all have received an email saying that you're invited to the website and you can view it. You can put comments and bits and pieces on that website, and we would encourage you to interact using that website. The other resources that you're obviously going to all turn to, because we all do these days, is to turn to Google and various bits on the internet. Don't forget there's the library there as well, and the library team are very aware of this and are happy to help you out with things like room bookings if you want to meet up and discuss, as well as helping point you towards information if that's what you want. I think it's important when we set you out on this that you have a couple of ground rules for your group, and I think one of your tasks next week is going to be to decide what are the ground rules for us as a group and how we're going to be friends with each other and stay friends with each other. So I think these are kind of fair ground rules. Respect each other. Respect the area you're going to. People are living there. The idea is that you go and observe. You're not supposed to embed yourself in the area. The way that you're going to do your research is something called non-participatory ethnography, which means just going and looking. Okay? And when you go out to your area, please recognise that you might look scary as a group. Okay? You probably don't think of yourselves as scary, but you may look scary, and people will be wondering why you're there and what you're up to. Bear that in mind when you go out. Another part of respecting the area you're going to is to think about how you use social media. And I would strongly encourage you not to ruin fantastic fledgling young careers by putting something on social media that could follow you for the rest of your career. Okay. It's a mistake that can be very easy to make, and we all come up with the one really cutting, sarcastic comment that we think is really funny that falls flat. It's funny when that falls flat in a room like this. It's really not funny when it falls flat and comes back and hurts your career for the next 20 years. So be a little bit careful about how you use social media. There's some resources, again, on the website that point you towards something made by previous students called Hashtags in Healthcare, which I would strongly advise you to go and have a look at, because it does get you thinking about how you're going to use social media and how it impacts on things that you'll be worried about for the rest of your professional lives, like patient confidentiality and other issues like that. And finally, I've got respect those who've helped make this program work, and by that I don't mean me. I've got a pretty thick skin, you can throw stones. We're going to be using video of real patients in this process, and those patients have come forward and given up their time voluntarily for the price of a bus ticket and a couple of biscuits. They're talking about some pretty personal stuff, and we would expect you to respect their confidentiality in that. They know that you're going to be viewing their videos, but they rightly wouldn't expect you to be discussing their videos with everybody under the sun. So use it as part of your learning, but please don't feel that you need to share their experiences with the world sometimes. But I think that question there about how would you make a world where every child has the same right to life, that's the question that I would hope that you'd be seeking to answer with this. And we've used some of these concepts here from Oxfam where they've talked about how can we make our students global citizens? How can we help you guys be prepared to live in the world that you're going to work in? Because half of you probably won't work in Sheffield. Most of you will spend some time in your life working in another country or another place. And inevitably, as the world gets more connected, you're going to be working in more interesting places. And the bit that I really like out of this is number 4 here. I want you to be, at the end of this process, I still want you to be outraged, okay? I want you to be angry about social injustice and about what's not working in the world, because until you become angry, until you hold that anger, you are unlikely to be able to do much to change it.